Hello again. It is South Africa tonight on this Thursday evening. Now, people with chronic lung disease are more likely to have severe COVID-19, and there's great concern about the impact on HIV and TB services. About 60% of tuberculosis sufferers are also HIV positive. Africa Health Research Institute scientist Dr. Emily Wong joining us via Skype to tell us more about what we could be facing here. Dr. Wong, a very good evening, and thank you so much for your time. And yeah, like we know, South Africa having the biggest HIV epidemic in the world and one of the countries with the highest burden of tuberculosis, and these two are often interlinked, as we know, a large percentage of that. How will COVID-19 impact us? What are the dangers we're facing here?
Well, the problem is that we don't know, but based on what we've seen in other parts of the world, we do have concerns that people who have chronic health conditions may be at risk of developing more severe forms of COVID-19 disease.
So are people with HIV and TB definitely more susceptible then to COVID-19?
So we just don't know, because so far, based on this epidemic, where it's been in the world, it hasn't affected populations that have large proportions of people with HIV the way we have in sub-Saharan Africa. So really, this is now going to happen, and we're going to have to figure out very quickly the answer to this question. We do know from the experience in China that people who have chronic lung disease have tended to have more severe forms of COVID-19 disease. So we are concerned that people who have tuberculosis or tuberculosis damaged their lungs in the past, and now they have post-tuberculosis chronic lung damage, that they may be at risk of more severe COVID-19 disease.
So what extra precautions should these patients be taking at this time?
Well, I think the key messages are actually the same for these patients and for everyone, and those are really twofold. The first one is that we all have to keep in mind the way that this virus is transmitted between people. And primarily, when someone who has the virus coughs or sneezes, the droplets land on surfaces around them or on their own hands, and then they touch things, and when the next person comes along and touches those same things, then they have a little bit of virus on their hands. Now, the key thing is, if they use their hands and touch their eyes, their nose, or their mouth, they put the infection into their own body. But we can all stop this if we wash our hands till they're clean before we touch our eyes, our nose, and our mouths. And we also have to be more mindful of what we touch. We should really try not to just touch everything when we're out and about. You know, even with the lockdown, we will be going out to get food. When you go out to get food, hold your hands together. Be careful. Don't drag your hands around touching everything. If you do, that's okay. You don't have to be frightened. You just have to wash your hands before you touch your eyes, your nose, or your mouth again. So those are precautions that everyone should take. And then we all must listen carefully to what the president is directing us to do and stay at home as maximally as we can, avoid contact with people outside of our immediate household and our immediate family. That protects the people in your family, it protects you, and it also protects us all because it stops transmission.
Dr. Wong, are there any particular concerns, though, around us dealing with coronavirus, COVID-19, the resources that seem to be going that way, and what impact that will have in terms of taking care of HIV and TB patients and giving them the service?
That as COVID comes through, it puts incredible strain on the health system, and we are, of course, all concerned about that happening here in South Africa and impacting on HIV and TB services. But that's why I have to commend the wise decision by the president and by the government to actually put this lockdown into place early, because it's exactly what we're trying to prevent. So everyone now needs to do their duty as a citizen to protect themselves, but also to protect our vulnerable populations in the country, and take this very, very seriously. And we try to, what we say, flatten the curve and ensure that the burden that comes into the health system doesn't hopefully overwhelm the health system.
And, you know, Doc, you speak about our programs here when it comes to HIV and TB as well. And can any of the research we've done, particularly pertaining to vaccines here in South Africa, is there anything that we can contribute in this scramble for a cure or a vaccine for COVID-19?
Yes, you know, just before this call, I was on a call with the African Academy of Sciences, and there is an active interest in ensuring that vaccines and drugs, as they're studied throughout the world, come here to Africa, that we do some of these trials here, and that we identify the most vulnerable populations so that when these become available, we can utilize them here. So that thinking is going on currently as we speak, and it's a big priority. I think South Africa is very strongly positioned for this because we have a very strong network of vaccine trial infrastructure in the country that's been used for both HIV trials and TB trials. We have a very, very strong research environment and a very dedicated citizenry who have signed on to support those trials over the time. So hopefully we can use that infrastructure and turn it into an infrastructure to test vaccines as they become available and drugs, and then quickly pivot so that our people can actually see the benefit of those discoveries as they come down the line.
Thanks very much, Dr. Emily Wong there. She's from the Africa Health Research Institute.